So I'll introduce myself to begin with. If everyone could put themselves on mute, that would be terrific. Is there a echo? Nope, we're okay. All right. So good afternoon or good morning or wherever you're calling from. I am Susan Reinhardt. I am a Senior Vice President and Director of the Public Policy Institute at AARP, which houses the Center to Champion Nursing in America, where I serve as the Chief Strategist for the center, as well as for family caregiving initiatives. And with me, you can see her right there, is Dr. Ashley Darcy Mahoney. She's waving a little bit. And you can see from the slide that she is the Robert Wood Johnson Foundation Senior Fellow Scholar in Residence. She's our liaison with RWJ right now, and she's a professor at George Washington University, recently tenured, I believe, Ashley, recently promoted. So thank you. And thanks all of you. I think we have over 56 people now so far. Thank you for taking the time today to join us on the Health Equity Innovation Fund Awards. We're really excited about this. I see the thumbs up. Thank you so much. These awards are being administered by the Center to Champion Nursing in America, CCNA, which is part of now our AARP Center for Health Equity Through Nursing. And we're very excited about that. I think most of you, if not all of you, know that CCNA is an initiative of the AARP Foundation, AARP, and the Robert Wood Johnson Foundation, and it runs the Future of Nursing Campaign for Action, which is an initiative of those same three organizations. This program is focused on advancing health equity and eliminating structural racism and other structural inequities. Structural racism is pervasive within the nation's health and healthcare systems. I know if you're on this call, you know that, and you are invested in changing that. And because despite progress that we've been making, there's still many significant barriers to health and well-being for far too many. And initially, health and wealth disparities disproportionately affect people of color, as well as older Americans, women, people with low income, those with disabilities, and those from LGBTQ communities, and those who live in isolated rural communities, all of which both the foundation and AARP are quite focused on right now. The National Academy of Medicine released a long-awaited report that you hopefully will remember just last May, giving us a path to advance health equity. And so therefore, we've been wanting to propose projects. We have done innovation awards in the past, but this one is really focused on stimulating new and innovative solutions for achieving health equity, those that particularly align with the NAM report, The Future of Nursing 2020-2030, charting a path to achieve health equity. So I'm going to turn it over in a moment to Ashley, but a few housekeeping notes. You know, we need to do that on these virtual platforms. It's being recorded. I think you know that because you had to probably say yes. And it's going to be available on our campaign website. We also love it when you use the chat function. We think that is really very helpful to share your ideas, to ask questions, to make comments throughout the call. And we will answer questions posted in the chat during the Q&A portion of this webinar. You can also use your raise a hand. Sometimes people just wiggle a lot, and we can figure that out too. But we will update our frequently asked questions portion of the documents that we will have on our website with the questions answered today, and questions that we see in the chat that we didn't get into, or other questions that come up, because there are often different questions that come up. So to ensure the best audio, I think you're doing very well already, to keep yourself on mute unless you're speaking, and take yourself off of video unless you are speaking. It just helps with the transmission of everything. So Ashley, I'm going to turn it over to you to provide some background on the report and its relation in particular to this grant award. Thanks, Ashley.
Of course. Thank you so much for having me. So I'm here to just give us a little bit of background, both on Robert Wood Johnson Foundation's attempts at dismantling structural racism and moving health equity forward, and how that also aligns with the Future of Nursing report out of the National Academy of Medicine. So many of us on this call have done this work for a very, very long time. And I think there are many other people that work can and will be centered as we think about these innovation grants. Some of what I will sort of say now is not unknown to many of you. And so I sort of deeply want to recognize that this is This is a really important to the Robert Wood Johnson Foundation, and we all believe really instrumental in moving health equity forward. Systemic racism often and deeply harms health by placing people of color at socioeconomic disadvantage, depriving them of access to key resources and opportunities needed to enjoy good health. Systemic racism is racism that is pervasively and deeply embedded in systems and structures such as laws, written and unwritten policies, and is widespread, deeply rooted, and has established practices, beliefs, and attitudes that produce, condone, and perpetuate widespread unfair treatment of people of color. Addressing systemic racism is crucial for achieving health equity, and that is the focus of these innovation grants. It is far easier to enact initiatives that mitigate the harmful effects of systemic racism while leaving the unfair systems and structures in place, or a focus on short-term improvements rather than sustained or fundamental change. The focus here is really on thinking of the systemic and institutional portions of dismantling structural racism. We deeply understand that the interpersonal and internalized parts of racism are also incredibly important, but these innovation grants are aimed to get at the institutional and systemic portions of racism. There is no single solution, and addressing systemic racism will require multiple reinforcing strategies across different sectors and different places, from local to national levels. Effective approaches will activate and support people to learn, speak out to their children, their friends, their families, their coworkers, organize their neighborhoods, their towns, their states, or nationally, and support and join and become leaders in this effort. I say that because when you're thinking about these grants, we want to emphasize that we want proposals to address the systems and structures that perpetuate racism and injustice. We don't want proposals that only address interpersonal racism. And so I want to direct you in the link that if you want more information about how Robert Wood Johnson Foundation is thinking about and investing in dismantling structural racism, go ahead and click that link. It was a study that came out or sort of a publication that came out from UCSF in January, and I think it was a good place for you to also get some more information for how RWJF is thinking about structural racism. Next slide. So as Susan mentioned earlier, the National Academy of Medicine report released in May of last year called for the future of nursing to chart a path to achieve health equity. This report first and foremost recognizes that promoting health and well-being for all has long been an essential role of nurses. The reason is simple, because nurses are everywhere, in ICUs, in clinics, in schools, and on the front lines of disasters and pandemics. And as the largest and consistently most trusted segment of the health workforce, nurses are well suited to advance health equity in the United States. But in order for nurses to do that, we need more support from systems that educate, pay, employ, and enable nurses to continue to do this work across the board. We need to value nurses, and we need to make sure that nurses have what they need to advance health equity. Next slide. The vision of the report was that the achievement of health equity in the United States should be built and strengthened on the nursing capacity and expertise. And that is really where we come to you now to begin to think about how to create innovative solutions to help advance health equity, and in particular in these innovation grants to help dismantle systemic racism and change our systems to be more just and fair for everyone. Next slide.
Thanks, Ashley. So let's just jump into the awards. I can't tell you how excited we are about this. This is funding from AARP itself, this new center that we have, and then RWJ Foundation partnership, which has been going on for 15 years. We're so excited about that. So let me share with you, it's all on the screen right there, but here are the eligibility criteria. We're looking for solutions, obviously, for improving health equity, including efforts to, just as you heard, dismantle structural racism and other structural inequities within the nursing profession, healthcare systems, or communities that lead to improved access to care and services for those most disproportionately impacted by health disparities. So that's the big eligibility solutions that address this. Then the next one is that the solution should be supporting or advancing one or more of the recommendations of the NAM report, which you just heard Ashley review. We've had forums on this. We've had summits on this. There are a lot of recommendations here. So there's lots of room to link, right, Ashley? I see her nodding her head. To show evidence of the project's potential for replicability and sustainability, and to show evidence of diverse and genuine community partnerships. So those are the main eligibility criteria. But there's a bit more if we can advance the slide. So applications submitted by the Campaign for Action, state action coalitions, or an approved organization affiliated with the state actions coalitions will be viewed more favorably. So we are spreading the word really far and wide, and we will give priority, of course, to action coalitions and their partners. But we are aware that there are a couple of states that don't have action coalitions at the moment, so we certainly want to make sure that we gave room for others. And preferences will be given to applicants that are either public entities or nonprofit organizations that are tax exempt under Section 501c3 of the U.S. Internal Revenue Code. And we also want to underscore that we cannot fund anything that has even hints of partisanship or calls for specific legislation. Next slide. So here are the details. We're very happy to say that we will be awarding up to $50,000 for projects that can be completed in 2 years or less. This means, I'll jump down to the bottom one, that we are not requiring matching funds. Previous innovation funds that we have done did require a matching fund, but we are not requiring that now. In fact, that's what AARP has done, is provide the funding for it. But we do think that it's an additional opportunity for you to seek other funds and secure additional funding. We've seen in the past that having the support of RWJ Foundation and AARP Foundation is very powerful in seeking additional funds. So we just want to say that, but it's not a requirement. Awardees will be required to report on the impact of their health equity fund projects at the end of the funding period. If it's more than a year, we're going to be looking for a midpoint too. And I just want to share with you that that's very helpful for us to seek additional funds from other funders if we can say this is what's going on. So it's not just a technical, we want to drive you crazy with reports. It's more like, tell us how things are going so we can keep seeking funding to scale what you're doing. Next. So who should you collaborate with? So we said already that your project proposals must show evidence of diverse and genuine community partnerships, even if they're not funding you, those kind of partnerships. So, and working with them will really help you for longer term systems change. So that is really, really important. And we just put together this graphic to be talking about that. Collaborate with partners that have similar goals, like local health departments, housing authorities, schools, businesses. Join forces with other effective campaigns that are going on locally and community-based organizations, like tie it in with what's already going. You know, if a wave is going that way, it's always good to join together. Look for alternative funding sources. As I said, could be corporate giving, state or federal grants, or individuals as sponsors, and work with non-nursing. I know non-nursing sounds weird. We always call them nurse champion community partners to promote mutually beneficial policies that will lead to greater improvements in health and well-being. Next. So CCNA at the AARP Center for Health Equity through Nursing will provide technical assistance and directions for those who receive awards, but we will also help those that haven't even applied. We are here for technical assistance to help action coalitions and network members regarding of their funding status, particularly for stakeholder engagement, coalition building, sustainability, and communications. And for those awardees, we will provide a blog template and a press release, as well as social media toolkit to help you announce the award. To just request that assistance, just email healthequitynursing@aarp.org, and we will provide that again. So next is how to apply. So applications should be submitted as a PDF to this healthequitynursing@aarp.org by 10 p.m. Eastern Standard Time on Tuesday, November 15th. We know this is a rapid turnaround. That's why we were trying to get word out ahead of time that keep an eye out, things are coming. The RFP is not very onerous, so we think that this is more than doable. The application, the RFP, the FAQs, the frequently asked questions can all be found on the Campaign for Action website. And as I said before, we're going to continually update the FAQs as the questions come in. All the funding decisions will be made by a review team that is consisting of AARP, the Campaign for Action leadership, staff, and advisors. So I think we're coming to the questions or comments period. I'm going to turn this over to Jen Peed, who has been the strength behind all of this, pulling this all together. Jen, use the chat feature for questions or comments, or raise your hand, as I said before, and we'll call on you. And again, you can find the recording of this webinar and additional resources that will be on the campaignforaction.org/webinar. So let me turn it over to the marvelous Jen Peed.
Thank you, Susan. Thank you, Ashley. So we do have one question in the chat. Elizabeth is asking if we have sample abstracts of funded grants. And we do have samples of previous, what we had called nursing innovation funds. The RFP back then for the last 4 iterations was slightly different than this. This is really focused, as Ashley and Susan shared, on addressing structural racism and structural injustices. So it's a little different. We don't have abstracts of that because this is the first of its kind for us, but you can look at some of the other RFPs, and they have worked on similar models, but not quite this particular call. I see there's another one from Heidi, and maybe Ashley or Susan, you could answer this one. Heidi's would love to hear what kinds of ideas you're looking for. It's a huge topic.
It is a huge topic, and we specifically didn't put guardrails on what we thought people could or should come up with because number one, I think the communities in which you live are probably the best people to come up with the answers to some of these questions, where all of us live across the country may have different ways in which racism plays out. So we tried sort of specifically to keep this broad because we sort of deeply felt that every community might be different. So I wish I could tell you that I had in mind exactly what I think we want, but we don't have something specific in mind. We are here to have you all be the innovators in your community in ways in which you think this small amount of money, we understand this isn't a gigantic amount of money and we don't expect a gigantic way to solve a problem. What we're trying to help you all is to try to focus on the ways in which we can solve some problem right now, or a small problem right now.
And I would just add, if Beth were on the phone, I think she would add this too. We're looking for systems change in the long run rather than individual change. And I know that sounds very pedantic and a little academic, but I hope you know what we mean. And as Ashley said, it can't be like huge systems change immediately, but it could be leading to huge systems change, especially through those partnerships we've talked about.
To that point, Susan, another question that's very similar is there a specific scope or impact that's expected? So I think that gets back to systems change, right? This
right.
About changing systems that improve ways. I mean, I don't want to put the guardrails on either if I start giving specific examples, but if it's with, I'm thinking hiring practices or ways to elevate in the profession, if that could be one example, but don't take that to, don't take that to, plan all around that example. I'm just trying to help bring it in a place that's applicable.
So Jen, maybe one way to answer that is I think we're open. If you have an idea, if you just want to float an idea by us, we can, right, Ashley? We don't have to wait for you to have the whole thing done. If you want to send us an email or something and say, is this something you would be interested in looking at? It's not required. It's not like an intent to apply, but if you have questions, that would be fine with us. And I see Ashley shaking her head. It's good. Yes, Ashley?
Yeah, and I think going through we spent a good amount of time on the application and on the frequently asked questions page in the website. So I'll just sort of say it again, just so that we have it recorded for people listening. The project is aimed to improve health equity and specifically efforts to dismantle structural racism, other form of structural inequities within the nursing profession, health systems, or the community that can lead to improved access to care or services for those disproportionately impacted by health disparities. And I will copy and paste that in there. But that is what we're looking for. So yes, it's a very big sort of broad description. But I will say that is the focus of what the projects we're looking for.
Great. A couple people have asked how many awards will be granted?
Very good question. So it depends on whether the requests are always for 50,000. So currently we have about 300,000. We continue to look for more funding. We hope to have another wave next year. We more than hope that we will have another wave next year, and this will become a rolling program. That's what we're hoping as we keep seeking other funds. So if we had it could be 6, it could be 10. We'll have to see what the requests are.
Okay, great. Elizabeth, I'm not sure I understand your question. Elizabeth asks, may we make sure that there's seed funding for each state for increased impact?
There would not be seed funding for every state.
And let's go. There's some more in the chat, and someone has their hand raised. Susan Moyer, you want to ask your question while I read the rest of the chat?
Yeah, thanks. And thanks for this opportunity to apply for some funding. We're tossing around a lot of ideas. And so listening to you talk, I'm thinking that one of our ideas might not work. So one of our group that's working on, our advisory committee group who's working on sub recommendation number 1, they've really narrowed it down to looking at the discrepancies in our maternal child health and how Black women are at such a disparity in our birth outcomes. And they have done a lot of work at bringing people together for shared agendas, yada, yada, yada. So what that group has really identified is that it is the bias of providers that is really leading to some of those inequities. So we were thinking, we have nurses who are qualified to do bias type training for healthcare providers, specifically for maternal child areas. Now, what I just heard you say, though, that to me seems initially at an individual level, not at a structural level. So I'm kind of feeling like that's not what you're looking for.
Well, thank you for that question, because I'm sure other people are kind of confused by what I said too. I'm going to turn to Ashley and then I will add mine, but I'd love if she's the expert in this field. So go ahead, Ashley.
Well, I'm not sure that I'm the expert in systemic racism. I surely have better colleagues that are at that, but I do have a lot of maternal child health expertise.
Exactly.
Yeah. So I will say that does feel a little bit on the sort of interpersonal side. If there's a way that you can sort of think about how those interpersonal biases lead to systemic racism in care, where those sort of come across at an institutional place, then I think there's perhaps, a way to say these interpersonal biases really affect us at a systemic institutional level. The Black women in our hospital have higher rates of X, Y, and Z. We have higher rates of preterm X, Y, and Z, more or less pain management, and so that your focus is on that institutional change. You're trying to change something at an institutional level, at a community level, and here's the path we think to get there. I think that feels a little more like less of like I'm trying to change one nurse, but rather a larger system change. Is that helpful?
That's what I was going to say. And whether it's tools or training programs, or especially things that could then be replicated outside of your own, place of employment that you're talking about, it can be spread around the state or the country. That would be amazing. That would be really helpful.
That's great. So here's a great question from an MD on the line. I'm a medical doctor and want to support my nurse in her application. Is that okay? Or does she need to do this on her own?
No, that's fabulous. That's a great, thank you so much for that question. No, that's a wonderful idea. We're looking for interprofessional and cross-sectional, kinds of partnerships, but definitely, Ashley, let me assume you agree with that.
Yes, ma'am. I don't think any of these changes are going to happen with just one discipline.
Right.
That's great. May a state submit multiple applications? Yes.
It's not, yes, yeah, generating, it's not one per state.
Right. Although we do want to reiterate that those with the state action coalitions are viewed more favorably. So consider your partners.
That's right.
That gets to that next question there. In fact, Dr. Farron Epps, I know out of Emory, had a question about whether you can submit through your university. So maybe Susan, you can describe about how the relationship between academic institutions and state coalitions works and how we are really thinking about what those partnerships need to look like.
Sure, an academic university can apply and has in the past for other innovation grants. What we're looking for is some collaboration. I don't know what you would be focusing on, but let's say you were using that other example we just did around maternal child health nursing. Is the hospital applying, or is there a university applying? Are you engaging students and ongoing? That really gets to structural racism and ongoing learning. So, Jen, I don't know if you want to give other examples that we've done in the past.
I think that's good. Wynn, can you think of any? I see Wynn's hand raised.
Yes, a few of one of the historically Black colleges and universities in Maryland several years ago applied for this. They secured the support from their action coalition. The Maryland Action Coalition co-lead said, yes, go ahead and we would support your application. And so they, one HBCU put in funding, but it was for a coalition of schools of nursing to have a mentoring program. So that's one example.
Thank you. Great example.
I saw Dr. F's follow up with the question is, what is it that they need to show that level of support? So when like a letter of support or like, how is that?
Letter of support, and it doesn't need to be, this very long involved letter of support. It's just merely a message. So in this case, Dr. Epps is in Georgia. She would get a letter of support from Lisa Eichelberger, who would say, yes, we support this application for the fund.
And if it's a little more than support, like another organization might be the lead applicant who's working in a partnership with the Action Coalition, the Action Coalition would still support it, the letter of support, and you'd explain in detail in your application how that partnership is working to give the reviewers a little more insight. Earlier in the chat, Cynthia Bienemy had asked Ashley if we could go back to the slide that looks at the various levels of structural racism and provide a brief explanation. I don't know if I feel like we covered it well, but I just want to revisit with Cynthia to make sure she's covered with that, or if she's still.
Right. The font is very small in that oval.
Oh, yeah.
I think we can. We're going to post this PowerPoint. Are we going to post the PowerPoint or
yes.
just the recording? Yeah.
Yes,
So maybe we can just post the PowerPoint. That way you can see it. Because I think if you see it on your own screen, it won't look as small. Maybe that. And I'll see if I can find it on RWJ's website too.
Okay.
So if there's more questions, feel free to raise your hand or post it in the chat. Here comes some hands.
Cynthia Bienemy.
Hello, it was just that, hello everyone, thank you for this opportunity. I had two questions. The first question in terms of the diagram, and when you mentioned interpersonal, I think I kind of went, someone else had mentioned that because we were looking at developing a dialogue on race, but just for nurses. That was kind of our idea. and that we would develop this curriculum and use the train the trainer. And this is just, things we've been discussing, and then take it on the road using our regional action coalitions and incorporating nursing, not only just nurses, but also nursing students in these discussions, because we know the largest sector of the healthcare workforce has the greatest impact on eradicating structural racism and addressing health outcomes in our country. But I'm not sure if this falls within those two levels, those first two levels, or you feel that that's more interpersonal. And the other question was, can multiple applications come from the same state? Thank you.
Ashley, you want to take the first one?
Sure. So we are really trying to think about ways to look at policies and laws, ways in which sort of systemic racism, even like, policies that are unwritten, ways that systemic racism has permeated into healthcare, and ways in which we can make that change happen. I think there is certainly an argument to be made that provider bias, including bias among health professions students and the upcoming health professions workforce, can absolutely lead to these larger systemic problems. So I think as long as you can make a case for the fact that the interpersonal curricula that you are attempting to enact makes a change at a larger system level. I think that is the goal here, to not just have these sort of one-off, points, but rather a change that can be more lasting, or at least that we can see some evidence that could be scaled. Obviously, this is small, but I hope that's helpful.
And then the second one is, yes, you can have multiple applications from within a state. I'm just kind of curious, though, if there's any connection to them, and if there's a lot of energy coming from a state that, be good if you knew it. That's kind of fun. And are there other funders from that state who would like to join in? That would be really good.
Thank you very much. Thank you.
Susan and Ashley, can I add a little bit to the first question that
Yes.
Cynthia asked? And Cynthia, it was so great to hear your voice. I miss you. So the Robert Wood Johnson Barnabas Health System in New Jersey has this fantastic program, Ending Racism Together. And one of the 6 components is focusing on the system and the individual. And so, I think some program, an existing program like this that shows that the interpersonal is also important to include, could be a good reference.
Thank you very much. Thank you.
Sure thing.
Any other questions? So folks are asking where we'll post everything. The last link in the chat, it's our landing page for this whole RFP. We have up there some resources, but we also have the actual RFP, the application template, and a running list of frequently asked questions that we will have an updated version tomorrow with some of the questions from today, but there's already many questions that we had anticipated that are on there. Last call. Anyone have project ideas, anything they're thinking of, they want some insight on?
Or they may not want to share it.
Yeah, this is
Right.
intellectual
That's
property here.
Right. It's like, wait a minute, that's my idea. I get that.
Yeah.
Maybe you want to put up the last slide. Go ahead, Jen. I mean, Wynn.
But the our landing page has a resource that people can go to if they have questions, right?
Right. And I think that's what we just put up too.
That's right.
Yeah.
I also paste, someone had asked about the previous awards. So here's the previous ones. Whoops. Is that not it?
And can they also find that on the website too, can't they?
They
Yeah.
can. I was just putting the exact
Yeah.
link.
Sure.
And
saw somebody-
Jeannie Niemoller from Wyoming, the great state of Wyoming, has her hand up.
Okay.
We can't hear
Jeannie,
you, Jeannie.
you need to take your mic off mute. Her mic is not on mute, but we still can't hear her. So Jeannie, if you can hear us, maybe you can ask your question in the chat. Oh, okay, or try that.
While we're
We
waiting,
can't.
I'll just give another plug for something else we're doing while we're waiting. And that is that, Jen, is it the 14th or 15th of November? We're doing this event. First time ever. Is it the 14th or 15th?
The 15th, November
15th.
15th.
It's a big day that day, November 15th. We have 38 million members at AARP, and we found out fairly recently that over 1 million are nurses. And we have the right, they have given us the permission to contact 400,000 people, said, okay, you can contact me. So Jen has been leading this volunteer engagement effort with our Office of Volunteer Engagement, which falls under another part of ARP, to offer these nurses who want to volunteer different ways they might do that, you know, and once we find that out, we'll see how over 1,000 are registered, Jen. I don't know if there's more now.
1,500 as of this
1,500
morning.
1,500 people registered for this already. So we're kind of interested in what happens, but we would have these names to link up with you if you wanted them. So it's a brand new thing, and ARP is pretty excited about this. It's the first ever, and they can do it for other groups, but we think this is the most members that we will have on a given platform. Okay,
That's
did we
right.
get the question?
No. I've
Not yet,
suggested in
Jeannie.
the chat to Jeannie that she either mute her computer and call in through the phone, or hang up now and call and come back in on your computer. That's either one of those options normally work. And in the meantime, Roxanne Chase Wiley has her hand up.
Okay, Roxanne?
I apologize. I came in late on the webinar, but I have multiple questions. First question is, partnering with your local mayor's office, is that, so that's a yes, right? That we're allowed
That's like a wow.
Okay. So, all right, so that's good. And then how many awards are going to be given out?
And I was saying, it depends on if we get any extra funding in the meantime, but right now we have 300,000 total. So depends on whether everybody is asked for and documents the need for 50,000. That's what we're going upward. So it's at least 6, but maybe more.
Okay. 6. And then for those that are not awarded the funds, is there a space on the landing page where other ideas would be made public?
Oh, that's a great
That's a
idea,
great idea.
actually.
Yeah.
I love that idea, because in the
Yeah.
meantime, we're going to keep trying to raise more funds.
Yeah.
And so that would be fabulous. It would help us to talk to other funders. Here's some ideas.
Right.
And
Yeah.
our goal is to get funding to you to do the work. We will need some additional funding for our own infrastructure to support it, but mainly it's getting out the dollars at the local level.
Got it. Those are my questions. Thank
Great
you.
idea.
Great questions.
Yeah.
And idea, mayor's office. So hopefully our friend from Wyoming will call back in, Jeannie.
Okay.
Jeannie has done really great, right? Oh, is this her? Right? She had
Nope, that's Jean. Yep, they're past recipients of innovation awards, and they've done some great work on bringing rural telecommunication access, which
Right.
is what she's struggling with today. The phone line.
And, right, exactly. But
That
with
is so
nursing
true.
students helping older adults with digital literacy.
So
Yeah.
great.
Yeah.
You know, I'll also share with you, I talked to one foundation a couple of weeks ago that are really interested in impact, and they're looking for ideas. It has nothing to do with us per se. Actually, this is a funder for the long-term services and support state scorecard that I do with another team. But when I started talking about different ideas in nursing and workforce, they got very excited. So that's what I mean by other funders, other partners. I know Robert Wood Johnson Foundation loves that, more the merrier, come on in. But they're looking for impact. And I don't know that we said that enough today, but when we talk about, systems change, that is impact. So just want you to know there is interest out there from other funders to join in this work. So I don't think there's any other questions. I want to thank Jen for facilitating this and for helping us pull it together. Ashley, thank you so much for you and for the Robert Wood Johnson Foundation. Wynn, all of you on the phone, thanks to the team at CCNA who always puts it all together. Oh, I think Patrice has her hand up.
Mhm.
Patrice?
I selected the wrong emoji. I was just congratulating on the success of it. So
The high five.
Okay, lots of high fives. Thank you so much. We look forward to getting your applications. Take care, everybody. Bye-bye.
Bye. Thank you.
Thank you.
Bye.